Hello, everyone. Good evening or happy afternoon, depending on where you're joining us from. I'll give you a few more minutes to join us and get some more people in the waiting room, and then we'll get started in just a few minutes. Perfect. If you feel comfortable, it'd be great if you want to turn on your camera so we get to see you. Of course, we also respect your privacy if you decide not to. That's also all good. All right. I think we get started just to be respectful of your time and more people are joining. So welcome to yet another NoTube Q&A. My name is Dr. Marian Russell, and today our topic will be online treatment, how we support your child in learning how to eat. And through this Q&A, we have myself, but also my wonderful colleague, Dr. Lily Beckenbach. And we will start with some introductions of who we are here today, and then I'll go over a little bit our kind of outline for today, how we're going to kind of structure our next hour together. So, Lily, I will give the word to you. What is your
Thank
role
you,
at
Mariam.
NoTube?
Hi, my name is Lily Beckenbach. I'm one of the pediatricians of our NoTube team, and I'm also specialized in pediatric palliative care and also nutrition medicine. And I'm since many years now, I'm mainly doing the net coaching program. This is our online program for our tube weaning program and also our Learn to Eat program. And I'm very happy to see and hopefully hear some of you. And Marion will hand over to you again.
Okay, good. Okay, I'm Dr. Marian Russell. I am an occupational therapist by training, joined NoTube many years ago, and I'm actually located in Omaha, Nebraska. And Lily, you were in Germany, right?
Ah,
You're in Munich,
I
is
forgot
that
to say
correct?
yes. I'm
Mhm.
I'm located in Munich, in Germany. Yeah.
Yes. As you can see, our team, we cover many time zones, and but I'm also originally from Germany, from Berlin. So today, how are we going to envision our time together? So this is a Q&A, meaning that you have the opportunity to ask us questions directly by just unmuting and just having a conversation. We do have a few questions that people emailed us about, so we can certainly go over those as well for those who are joining us later or who'll be watching the recording. That being said, this meeting is being recorded, so that's just for you to be aware of. And what would be great is like when you unmute and ask your question, if you could just tell us quickly whether you are a caregiver or a professional. So this way we can kind of see to how we have to gear the answers to your questions. So let's open up the floor. Anybody has a question for us before we can kind of talk more about what we have to offer at NoTube? Any specific questions about how do we support your child at learning to eat?
Hi, can you hear me? Hi, I'm
I
Nazia.
can.
I'm a parent. My daughter is 22 months now. She was born with kind of congenital heart issues and had poor weight gain. And so she was fitted with an NG tube to kind of help with her weight gain at the beginning. She has since had surgery and her heart issues have been repaired. But she still has ongoing feeding problems and is still um, mainly fed via a tube, although she does take small amounts kind of
Mhm,
orally.
mhm,
She yeah, she kind of gets stuck on um textured food. So she's okay with purees, but anything kind of bigger than that she'll gag on. And I just wondered like what's the method? Because the UK, so sorry, we're based in the UK, and
yes.
the problem with kind of tube dependency, they're not really very good with how to wean them off the tube. And kind of the recommendation we've had is for her to be fitted with a peg and fed overnight. Although she has no kind of swallow problems or any kind of anatomy issues that we're aware of. She's also here. So I
Yes,
just
I can hear her in the background.
yeah. So I was just wondering what's kind of your method and why isn't it kind of widespread elsewhere? Um, and
Good question. Yeah.
yeah, yeah.
Okay. Nadia, this is a beautiful example and kind of gets us into explaining, okay, what are we offering and what approach are we using? So your child on the tube and the discussion is coming from the peg, is it yes or no? But yes, she shows oral readiness to eat,
Mhm.
but is still being tube fed. So how do we at no tube handle that? Lily, do you want to give it a yes? I know I can see you want to answer, so
Yeah.
please
Oh
do.
no, it's
Hi,
her. I'm
Nadia.
just gonna mute myself because she's
Sure.
screaming in the background.
That's
Okay, that's
fine.
fine.
So our approach, well, I think the difference to the UK, and I've also talked to doctors in the UK, say that they can't really supply the system, can't really supply the support you need for the tube weaning process because it takes some effort. And we in our team, we do nothing else, almost nothing else than tube weaning. So we have really a standardized and individual program. And that's why we're so successful because more or less we're doing nothing else than feeding therapy in the early, like 0 to 5 is the biggest patient group we treat. So if you tell me, or if I hear as a pediatrician that your daughter, was that right?
Mhm.
Your daughter, yeah. She is already eating some purees. The next step would be, of course, a tube weaning because we always have to ask ourselves, what is the tube for? And if there is no anatomical and no medical real reason keeping the tube, before putting a peg tube, you really, really need to do a professional weaning trial because your child has the right to learn to eat. And in case this trial would fail, then you could say, okay, she needs a peg for tube feeds overnight. But this is in very, very rare cases. In rare cases, you need a peg for the night tube feeds. So I would really, really ask you, and I invite you, first of all, book a free evaluation with one of our colleagues, and then apply for our assessment that we can really check and see if your daughter is suitable for our program. And from what you say, it sounds as if she would be suitable for our program. And she was in a good age with 22 months. It's fantastic. And if she's already eating something orally, it's the best moment to take this project and go for a tube weaning, a professional tube weaning trial.
Yeah.
Yeah.
And
Sorry, I know
that's
this
what I
is
can.
yeah. I was just gonna say sorry. I know this. I'm making it very about us, but
No, we're gonna use your case to explain how our
okay.
model works. So I was
Thank
just
you.
getting to how we're gonna do it. So that was the
Okay.
next step.
I was just going to say she has been so we do have a gastroenterologist and she has been diagnosed with reflux and rumination, but I'm personally I do really think that a lot of the problems are to do with the tube feeding, the high calorie formula that she's on, and because it's still a lot of milk, it's all very liquid in her tummy that it's still coming up. So um, sorry, I'll let you speak now.
Okay, now that's
Maybe before Marion,
cool.
you go, I
Yes.
just want to explain something. There is the tube dependency is a kind of vicious circle because the side effects of the tube inhibit oral development, and then the children can't learn how to eat, and that's why they need the tube. So this is kind of a vicious circle, and there are many doctors who think there's no way out of this circle, but there is. So the reflux and the vomiting, I think we do not have one child with not vomiting who is on the tube. So this is the most common vomiting, no appetite, and nausea and gagging is the most common side effects of the tube feeding itself. And as you said, the high caloric food, it's not easy to digest. and mostly the volumes are quite high for the child and so on. So this is this kind of vicious circle, and the side effects almost always disappear the moment we do a tube reduction, volume reduction.
Exactly. So this is how it works, because you've asked like, how do we do it? So I want to give you a little bit of an idea of what to expect. So as Lily has said, you're going to do an assessment, you upload some medical documents, some videos, and then the team will look at it and make a recommendation whether you are appropriate for this program or not. And then we can start right away. So there are no wait lists, which is, I think, a great thing because the way our team is structured, and you'll be assigned a pediatrician, which most likely will be Lily. You will get a feeding therapist, and you will get a psychologist. So we always work in a team of 3, which is lovely because you get 3 disciplines and you get 3 viewpoints and 3 people to work with. And our program is asynchronous, meaning that you're not required to be online and chat with us at a specific time every day, right? So it's asynchronous, so you can cater it to your needs. You would ask you to upload videos. We'll ask you to do a daily update. We have an intake protocol. We're really going to monitor what your child takes. If you keep Nazia's example, so what your daughter will take via tube and orally. You're going to put that all in. We're going to keep track of the weight. And then we do have a welcoming Zoom where you meet your team. I think that's important to us too, to kind of get you on board with our philosophy, which differs from a lot of other tube weaning approaches because we are child-led. So there's no prescribed formula of how many milliliters to reduce per day, and you have to be done in a certain amount of whatever, 2, 3 weeks or whatever. So it's really individualized, and we follow the child's lead. So you get daily responses from one of our team members, and we do it 24 hours, 7 days a week. So holidays, weekends, you have access to what we call our ticket system, which is really like a secure messaging platform. We'll introduce you to it. It really is really easy to navigate for you to upload videos and PDFs and comments and so on. So you have access to us, to a 3-people treatment team from the comfort of your home, which I think is very beneficial, especially when you're learning to eat and you ultimately, what you want to eat at home. You want to eat where your caregivers, your family is. So we'll guide you through that. Anything to add, Lily?
No, that's fine. Nazia, is there anything else you want to know? Otherwise, we would open up for the others.
Yeah, thank you. That was really nice and clear, and I think I just want to say, just for parents as well who are kind of dealing with feeding problems at home, the psychological impact has been very stressful. And I will say that I don't think that the kind of tube dependency is managed that well by kind of the caregivers here, in that we don't feel like we've been supported kind of I don't feel like Lana should have been left feeding on for this long by the tube. So yeah, it all sounds really positive, so I just want to say thank you.
And we do have many families from the UK because they all have the same problem. I don't know, Marvin, what is the English word for Versorgungslücke?
It's a gap in support, kind of. I feel like I don't know. There's a real good translation for it, but there's a gap, period. So, and people fall into that gap, and tube is placed for a specific reason, but then there's no exit strategy. Not because they don't want to, they just don't have the capacity, and access to the teams that would take care of that. And so as I don't know if you, Nazia, if you saw it, but when you mentioned the psychological impact, a lot of people here on this call went like this. So you are definitely not alone. And that is one reason too why we really, really want to have the daily communication. We take care of you too. Like, you are part of the treatment team. We value the impact that you are experiencing, your observation with feeding, and we really want to strengthen you as a parent and kind of give you that sense back and don't have you feel like left alone. So there's a lot of people out there, like community too, with parents who have experience with this. So you're definitely not alone. It's a shared experience.
Maybe I can say something about it.
Sure. Yeah.
We're our success story. Our daughter Emma was weaned off the tube 12 years ago by no tube. So she's almost 50 now, and all the parents, they all go through the same, and it's the hardest for the parents because with the tube feeding, they count every milliliter that goes in, and when they wean off the tube, they don't know how much goes in. Does she eat enough? Does she lose weight? So that's the hardest part, I guess, and trusting your child that it will eat enough, and that I think that's the most hard part about the net coaching, as I heard from most parents. Yeah.
Yes, thank you, Saskia. Absolutely. And weight is a big topic, right? Because, and I don't know, maybe Lily, you can talk quickly about how we handle weight loss.
Yeah. Well, we know that weight is a big topic because in most children, it has been a big topic since birth. And for some children, even before birth, because some children do have a lower weight than expected. So this we know that weight has different aspects and is very important for everyone. And so in general, in case of tube weaning, we looked at our patients, a few hundred, and calculated how much is a normal weight loss. And this is what other teams did as well. And you can say, depending on the age, it's something between 5 and 10% of the body weight can be. There are some children, especially the one who have already good oral skills in the beginning, and those kids mostly don't lose any relevant significant weight. But the children who start with oral 0, they do lose some weight, but we have a very close eye on it. So that's why we asked you to weigh your child every day or every second day so we can see the course of the weight. Because the weight for me as a leading pediatrician in the tube weaning process is one factor of many. So first priority is always the child has to be in a good condition, no matter of the weight. So the child has to be well. This is important. And the weight loss, we keep a very close eye on it, and we can influence the weight. And in some children, we come to a point where we say, oh, this child needs a little bit more time. So we make a little pause and we focus on weight gain again, and then we restart the weaning again. So this is also an option. And I know that it's not always so easy to reach this goal because some children, even if you do everything, the weight gain is not as you like it to be. So, but in general, we never go up to. We always set an individual goal. Let's put it that way, and this depends very much on the child. Where does the child start? In which condition is the child? And so on and so on. So we will also in the welcoming Zoom, as Marion said in the beginning, we will talk about weight. And I can say in the beginning already, even though I don't know the child really well already, like in the beginning, I can set a limit and say, I think I don't want to go under this and this weight. So we will talk about this topic very closely, and we have an influence on it, as long as the tube is in. So I think it's part of the winning process, yes, but don't worry too much on it because we will talk about it and we can set our goals,
our
well,
goals
and
that way.
expectations. Yeah.
Absolutely. And I think it's too is that kids on a feeding tube, they have an artificial feeding schedule. So now the kid is going to learn for the first time to self-regulate their appetite. So that is all going to be different and changing. And so we as a team, we really try to take that burden, that weight off from you. So it's like we are going to say, okay, now let's feed this much, let's do this. And it's for us, it's not a linear process. So I think it's funny, I always have this conversation with the parents, is that you're not really on a highway. You are sort of on you have a trajectory in mind, but sometimes you have to take a little detour just to pause, reevaluate, and keep going. It doesn't mean that you're stopping or anything. It's just you are continuing on this journey. And kids are individual beings, so they're not machines, so we can program them. So we have to see what they're giving us, and we want this to be a success, and we want all of us, the whole team, to be a good experience. It's stressful as it is. We know that for you at home.
And there's one thing I want to say, because some parents think if there is a weight loss or our Grazer model, some people think that it's a kind of hunger starvation program, and it's definitely not. So I want to really be very clear on that. There is no starvation and no hunger, but we need a kind of motor for the body to move, to develop something new. And this is why we need this kind of being hungry and being open for food, but not being too hungry. So this is the art and our job, and especially my job, to find with you as a parent who knows the child the best, what is the ideal amount of tube feeds. And this amount and times, and this needs to be adapted from week to week, because it's different. If oral development goes on, it's different. So this is I think our individual approach, that we always need to find the ideal tube amount and times that the child can move on and progress.
Exactly. Because the kid needs to be happy when they're absolutely hungry and they don't have the oral skills yet to kind of address that and supplement that hunger. Where are we going to go? We're going to go cranky, we're going to be upset, and we're going to have a negative feeding experience. So that's why we need to be that's the individualized approach. Yeah, absolutely.
We need the child in the best condition.
Yes.
Otherwise, we can't expect that the child learns something new. So I think weight loss is something we know is normal, and most doctors who do, or people who are in this field, also know it's a little bit part of it, but it's not. It's something we can handle in
Exactly.
kind of
Yes.
influence
Part
well.
of the journey. Yes. We have a question from Lisanne in the chat, and she was asking, I wonder what will motivate my kid to eat when the situation at home is not changing. That's a really good question. And I will tell you, you will need to change something. Yes, if nothing is changing at home, it's difficult to ask the kid to change if they're the only one that request is put on. So it has to happen with the whole unit. And depending on your kid's situation, you didn't say anything like details, whether it's tube or do we see selective eating. We would need to take a look at the situation and what is the smallest change that we can start with without creating too much insecurity. So that's also, I think, the thing from an online program is that I always say, like, we're going to move in with you for a little while, because we can say, can you take a video of a typical mealtime, put the camera somewhere in the corner and record for 2 to 3 minutes, and then let's see what's happening. When you're in this situation as a caregiver, it's difficult to kind of see your processes, your body language, what's the kid doing, because you have this pressure of feeding, of providing food. And we, as the outsider in this instance, we can give some pointers, just little things sometimes, of changing where to sit, changing how to offer it, changing how you eat yourself, how you approach the mealtime. To make small changes that we can invite the child into the situation rather than overwhelming with change. So it's kind of, when we say motivate, it's more like an invitation rather than the motivation. We don't want constant reinforcement motivation. It's like, hey, let's see what do you have to give, and what can we use as the treatment team to get you to the table, not on the table, to the table. Yeah, Lily, go ahead.
I would say that our job as professionals and you as a parents is to optimize the circumstances.
Right.
And
Yeah.
circumstances, this is what the things we can influence, because there are many things of your child you can't influence. So this is just the speciality and uniqueness of your child, but we can work together on optimizing the circumstances. And this is like positioning, texture, consistency, taste, situation, atmosphere, tube feeds, hunger, sleep, whatever. There's a lot of different things we can make changes and see how the child maybe can be motivated or can change something in the eating behavior. So if you want, you can add in your specific question what kind of motivation you would expect, and then we can maybe answer it more specifically. Otherwise, we can also hear others.
Yeah. Any other questions that you would love to ask?
I have one. Can you hear me?
Yes.
Yes.
Yeah, good. My 7-year-old son has been diagnosed with ARFID. Of course, all this, how can I say, information you're providing is, I mean, I've been hearing it for years. And I have done the assessment and we were kind of ready to take the program, what do you call it? The program where you go and stay at the clinic and all
The
this.
eating school?
Yeah, the eating school, correct.
Yeah. Yes.
Just because of other personal things going on, we haven't done it yet. But now with your online program is more possible because we live in Norway. So it's kind of moving the whole family to Austria was a bit of a challenge. Work-wise, we have other kids, so it was a bit challenging. But now with your online program, how should I prepare for that? If I want to go with this, should I also consider taking time off so I could take it on board, or I really don't have any. My mindset was completely on going there and kind of preparing the whole family, and now it's now I have another possibility. How do you plan, or how do you envision this to work with a Norwegian family on the other side?
Yes. Well, I can say, first of all, don't have to take time off. So I think we really want you to keep your routine. It's really important. You might at the beginning, depending on when you start and how it works for you, might need some extra support for yourself to know what you do for self-care. Because the expectations, the heightened stress of the program can always be at the beginning. So that's one thing, like have something in place for yourself, but don't take the time off. And so have you been in contact with us yet, whether you're going to do like a Learn to Eat? Is that what the recommendation was, or what was the recommendation from our team?
To take the eating school program.
Okay. And so you can make it and you're going to, okay. Yes. So for the new program that we are in the midst of refining, which will start probably, we have tentative start at the beginning of December, could be January. We have not quite set it yet. That will be also a mixture of asynchronous and synchronous. So there will be some face-to-face Zoom time, and the rest will be asynchronous, so on your own time, so not set to specific dates or times. So that's why I said don't take time off. Hopefully you can make those set video times that you will be assigned to once we start the program. So, but we're going to work with you on figuring out what's a good schedule, what fits into yours, and how the other people will join you in that. So you have to hang on just a little longer until that program is finalized. We are in the final stages. Our team is busy. Lots of questions about the eating school closing. I know there was an email sent out and everything. So that stay tuned. That's all we can say. And we're excited to be starting this new program to be more accessible for people all over the world. As you see, Norway, good example. It's
Yeah.
not,
And
yeah.
that's pretty much what is stopping me or has been. And of course, my kid is a priority, but I
course,
also, it's hard to move the whole family there for 2 weeks. So
Absolutely. And we heard it a lot from people, and we really wanted to make our approach, our team more accessible to people around the world. And we live in a global society, so that's kind of one way that drew us to that change as well. Anything to add, Lily?
No, I think we're just now in this transition phase. So I think if you, did I get it right that you have done an assessment already?
I have, yes.
Yes, okay.
Assessment
So
has been
you
done.
can, if you want, if you have the feeling it's now also something which affects your daily life, you can also book another free evaluation and talk to one of our specialists to see that we can check your assessment again of your daughter and see which program is the best for her online program. So in the moment, we do have this Learning to Eat program, and starting in January, we'll have a special kind of program for ARFID older kids, as your daughter you described. So probably this will fit very well. So maybe you stay in contact with us, and you can, without any costs, you can just book another free evaluation and talk exactly about your daughter and which program is best and when you can start.
Okay. Because I think we all have something in common, which is I feel we are stuck. We see no change. We see that our kids will never eat a normal plate of food. So it's I don't see. I'm sometimes become a bit negative or depressed because I don't know how this
Frustrated.
can be changed.
Yeah, well, we are specialized on exactly this kind of problem because we know how this affects the whole family and the daily life and how much conflicts there are. And this is just poisoning for healthy relationships. So I would really invite you to book another free evaluation and talk what solution. We are very adaptive and very, of course, it's very important for us to find a solution which works for you and especially for your daughter. So maybe you can book a free evaluation for next week, and then
Okay.
we can have a closer look.
Okay.
Right. I would
I'll do that.
ask too for maybe some strategies to use in the meantime to kind of prepare for the time there. So what can you do while you wait for the program to start? And that might also be helpful, just, kind of prepare you for it and your daughter.
Yeah.
Okay.
Okay. Thank you.
And maybe we can start even now if maybe this Learn to Eat fits as well and can be also very helpful. So
that's fine.
let's see. Yeah.
Okay.
All right. And Tanya, you had unmuted, and so I want to give you a chance to ask a question.
Yes, thank you. I'm the what's the word? Chairman of the patient union from the Netherlands. Nee eten, no eating. We had Eva visit us beginning of this year, and well, it spread quickly that you told you are going to stop the on-site eating school.
Yeah.
So I also wanted to know exactly what to tell our the families that follow us, because you are one of the large topics. So maybe you told something in the first minute, but he didn't want to let me into the program. But I wanted to know what's going on. Is it because like Peter and Margaret and Eva are going on pension, or?
Well, yeah, they're not getting any younger. That is correct. But it doesn't mean that they are less active, right? So they're definitely still part of NoTube. And for those who don't know, Professor Dr. Ronny Scher and Margarito Netscher, those are the kind of, how do you call it? Like
Founders,
but they're like more, they have like the philosophy. They're just,
Inventors.
Inventors, yeah, exactly. So they are in their 70s. So yes, of course, one wants to retire and do some other things, but their passion, their heart is with NoTube. So they will continue to be involved. I mean, we can't imagine it without them. So you can rest assured, they're all they're doing
Well, their
well.
names weren't mentioned specifically, but it made me wonder what
Now,
was
all
the
good,
reason.
all good. I can assure you.
Because what I hear from families, there seems to be more interest in the on-site program usually than in the online program. And I did the online program myself with my little girl, or she's not so little anymore, 11 years ago. So I can tell them, no, there's real value also in the
Yes,
online program. But I was wondering if there's coming an explanation or a specific statement. You just told there are different online programs coming. So
yes. So yeah, and you can assure your families that NoTube will be here and is here, and we are developing this new program to reach even more families. So just stay in touch. Check out our social media pages. You can write an email to us and watch our website, and we will make an announcement once the program is there. We probably very likely have another webinar just introducing the program that you can have families join, you can join, and then we'll give some more details. Because it's, we really want to take the spirit of NoTube and bring it into this new format, because we have more and more children with ARFID and highly selective eating behaviors who do not find treatment in their local teams. And we have found that,
yeah, so those, can I ask also, because we also see our patient union changing, because more the ARFID group is finding us, and there are still a lot more people that can find us, because often they are not tube fed, but it's more of really picking and selective. So your program is also working for that part, but you are fine-tuning it.
We're going to continue our net coaching, which is for tube dependency children with feeding tubes. And then we have this new program for the highly selective eating, ARFID, pediatric feeding disorder. And so that's what we're developing, or fine-tuning. It's already developed, but we just need to fine-tune it as a team.
Yes, I understand. Okay. So, that clarifies a bit.
Rest assured.
It's good to see you also going into that change of more ARFID patients. We find the same issue that our group behind us is changing in this.
And we need to address.
Want to be there for them too, and yes,
they're current, and we want to be there for all the families. So, Lily, do you want to add anything else?
No, I think, I think the NoTube concept, it will just, and also both of the founders will still have an important role and advisory, and will still be part of NoTube. And luckily they have family, which is like me. I'm the daughter of Margaret Dunnett-Scheer and one of my brothers, and also two of my brothers. We will keep this NoTube concept and just bring it in the next era and level. So you can be sure that the main part and the main concept will still be the same next year as well.
And is it also that you hope to help more people if you are doing more online than on site?
It's one of the it's one of the arguments on the arguments we had to decide this thing.
Yes.
And do you know if the price of the what is it, the
new program,
the new program will be the same as the net coaching program?
We don't know yet. That's all, right, Lily? But I think we're still
but roughly in the same.
It will be in the same ballpark, I think.
Yes. Yeah, that differs a lot from the on-site.
Yes, it will be much cheaper than attending the eating school, because of course.
Yeah.
Yes. Okay.
Yeah, but I think we also see a need of building community, because we see parents are isolated in their respective places, and so we're trying to kind of bring them together and have a place where they can be heard and understood. We're going to give them therapeutic interventions and really address the need that they are facing.
It's exactly what we also want to do, of course, with our patient union. So
we'll let you know.
If you think we should have more context, let us know. Of course, we also need to work with other caregivers, because there are other excellent programs in the Netherlands, and we cannot stick to one. But we get a lot of questions often about NoTube, so.
Sure. No, send them our way, and please, please, please stay in touch, because we really kind of depend on, we really love our local teams and who know about us, have experience with us, and can kind of help families answer initial questions. And then we, as I said, always book a free evaluation or send an email at help@notube.com. That will get to us as well, and we'll keep you.
Yes. Yeah, I think they know how to find you.
I'm sure you do. But for anybody who doesn't, this would be the way to get in touch with us. Yeah.
Yes.
Thank you.
Well, if anyone wants to see a healthy 13-year-old who did the program, Anna? Ja, je moet even komen zwaaien. You have to wave to the people.
You have to wave to the people. You don't have a choice, huh?
You have to. Come.
There's the hand.
No, she doesn't want to. It's
that's fine. That's fine. We respect that. Yes.
We're child-led, child autonomy. That's part of the program. So we're not going to make her. So
no, I don't. It's still a philosophy. Not with everything, of course. She has to do her stuff like homework and chores.
Yes. Yes. Okay. All right. Any other question? Yes, Julian.
Hi, my name's Julian. I'm speaking to you from Spain, and I'm here because my daughter Nuria asked me to join the meeting and keep an eye and ear on everything that you say. The point is, she has a 9-month-old daughter. She suffered a sudden death 2 days after birth. Doctors managed to rescue her, and she has a general delay of several months in various capacities from them. She has always been fed through a feeding tube, as you can guess, and they are currently trying to get her to start eating food without success yet. She has never had a sucking reflex. And that's the situation. We live in Spain, and she asked me to join you and learn about everything you say.
Okay, well, welcome. Well, thank you for joining us and for being such a huge advocate. So thank you. Appreciate that.
Thank you.
Lily, did you want to say something to the situation?
I'm not sure if I got it right, but can you tell me again, or Maren, can you explain me how was the family condition?
My daughter has a child.
My daughter has a child.
Has a child. Okay, got it. Just wanted to be sure. Does your daughter also speak English?
No, they are Spanish, and there's a big con that neither she or her husband can speak English.
Okay. Yeah, otherwise I would have said that she can have a look at because we record it, but that's no help if she can't speak English. So the problem is that we don't have a Spanish speaking person in our team, and we need a language to communicate with the parents. So first of all, we would need to do the medical assessment first of the child. So maybe she can ask someone to help her to do it in English, or also, for example, we do have many patients also of other countries, and then we ask them to translate, even just using the standard translation programs that we have a medical letter as well. And then we can try to find a solution, because I think we need one language to communicate. This is so. for French patients, we do have translators. So maybe we can think together if we find a kind of solution which helps us for the language barrier. But apart
Yes.
from that, I can just also invite her to make an assessment, because maybe even a evaluation of us can help her, that we can say how likely we think or how easy we think tube weaning process, if this makes sense at this point of age, at this stage, things like that. We maybe our evaluation could help her to maybe also find specific help in Spain. Because if we would say, yes, she's absolutely ready, then it's a difference is if we say, oh, this is still, she's not stable enough, whatever. We need to wait a little bit more. So maybe she can organize to do the assessment, and then we can see if we find a solution for the language.
Good. Thank you.
Yeah, definitely. Thank you. Thank you for being here. And any other questions?
Elisa.
Hi.
Hi.
Yeah, so I have an 8-year-old daughter, also has congenital heart disease. And so she got her G tube at just a couple of months old. And then she also got a tracheostomy at 8 months old. So I have a couple of questions. I'm curious to know if you have any thoughts on whether her having her trach, which will hopefully be coming out in the next year, is impacting her eating. But also the biggest challenge we have with her and her oral aversion is she just didn't have the strength in her mouth and the skills to with her tongue and the muscles in her mouth to be able to move food around appropriately. So we've been working with a speech language therapist that it has helped us with building up the strength. And now she's gone from eating some pureed food to taking bites of like goldfish or pretzel sticks. But I mean, it'll take her a half hour to eat like 4 little pretzel sticks. So she kind of waits for it to dissolve in her mouth and then swallows it.
How does your daughter cope with saliva?
She does better now. She used to always spit all of it out. But since we've been working on strengthening her mouth and her swallows and things, she doesn't have that drool like she used to.
And the purees, you said if she tries purees, she can swallow it, and that's okay.
Yeah, and she's passed all of her swallow studies.
Excellent.
She just doesn't want to. She just doesn't want to do it.
Yes. Well, not one, and she's never done it, and she never had the need to eat with a pack. So we do have actually many patients with a tracheostoma and a feeding tube. So this is something we're very used to. And for me, as the leading pediatrician, it doesn't really. It's good if this is first, the trachea, you get rid of it first, but it doesn't really make a difference. So we can do both, but I wouldn't do both at the same time. The weaning here and the weaning of the peg. But it sounds as if she, from a motoric point, seems ready, but she's 8 years old, so we have a very high mental dependency as well. So I would also invite you to make an assessment, that I can have a really good picture of your daughter and of her medical situation. But from what I know, she sounds as if she would be also ready to go for this oral developmental step. And what you describe with the pieces, it's quite a big step already that she's accepting it in the mouth. But we would probably advise you to just give things that dissolve in the mouth. So there are certain crisps which are just kind of dissolving in the mouth. So those are much easier to practice. And we would first always focus on fluid and pureed food.
Thank you so much. Very helpful.
Definitely get them start there and kind of get her in there, because a lot of times kids will try to eat food that actually burn more calories than they take in by chewing it. So really being mindful of the first goal is to get her off the feeding tube. Of course, you can always like do her goldfish. I mean, that's a very popular snack where I live. So and surely part of it, especially if she's initiating it, kind of seeing what are her likes and dislikes and flavors. Goldfish is more savory. We can, work on that and build from there.
And
So definitely,
if she can cope with it and is not gagging and kind of just spits it out, that's also fine. I mean, it's just practice. This is perfect practice, but she can't live on it. So we would really recommend the tube weaning first, and then the eating training is part of the tube weaning process.
Yeah.
Okay. Thank you so much.
Marian, I got a question in the chat.
Yes.
I don't know who it is from though, but I asked this question because my son is 4.5, is eating better when we eat at outside the restaurant. Have you seen the question as well, Marian?
Yes, I send it to you because Lizanne sent it to me privately, and I send it over to you. That's
perfect.
the clarification of our question. What if nothing changes at home?
So we've done this already. Perfect.
Yes.
So we're open to more questions.
So the thing is now, like, they eat better when they're eating outside rather than they're eating inside with the family. And I'm not sure if they still have the feeding tube or if that has been removed. I wasn't quite sure from the message, but so my first thing would be, I would take a look at what happens when you're eating out. Are you more relaxed? Are you more engaged? Are you actually distracted from paying attention what your child is doing because you're socializing with the people at the table? So I would have a look at those context cues that might be happening that makes it so much more enjoyable to eat outside rather than in the home, where the focus might be even more on him, what he's eating, how much he's eating. And the mealtime stress might be different. So that might be the first change I would take a look at to see.
And distraction could also sometimes help for children.
Yeah, exactly. Even if you have a conversation with other people and kind of not look too much to your child, that might be different from when you're out, because you are yourself distracted and so is the kid. So thinking out too, like, place the kid, like, can he be sitting somewhere where he sees the whole room rather than just the corner, or depending on how your setup is at home. I feel like in the environment you can do some nice little changes before kind of looking closer at what he's eating, or more than
different setup. Some children don't like the setup, the original setup.
The expectation, and at home, the table at home comes with expectations. It's very different than when you go out to the restaurant. I know my expectations are different, but great question. So we have 7 more minutes before the end of the hour. Yes, and is there any burning question that we can provide a quick answer? You're more than welcome to unmute now and ask that. And let's see. Okay. Yeah, we have one question here in the chat. There were just a family too that was recommended to go to Graz. Now the kid has a PEG tube, and they're asking kind of what to do now since the eating school is closing. So it's similarly what we had said earlier to, I think it was Jessica.
Yeah, I think this is very specific for, I don't know which name is behind that, but I would probably, we know each other then, I would assume, and I would ask you to write me an email or write us an email on the help@notube.com, and then we will talk maybe on the phone how and which is the best option for your child. I hope this is helpful. Perfect. Yes, great. So we're looking forward to your contacting me or the team.
Absolutely.
I have a small question.
Yes.
Sure.
We always loved when Eva came to the Netherlands and held the play picnics to promote NoTube. It's been a long time, and I was wondering if you ever be willing to host any of those again.
Yeah.
It's not out of the question. Yeah.
We
Go ahead.
actually, I don't know in which kind of program, but maybe you write her an email as well, because she has been in the Netherlands this year, because we do have one team member who speaks Dutch as well. So this is maybe you just write Eva an email and ask
Well,
her.
I text her on WhatsApp. I have her mobile number, so
There you go. You
Okay,
just
yes,
text
you can
Eva.
do this.
She'll let you
Yeah,
know.
or write an email. Mostly all emails on the help address she gets as well. So just ask her when the next time is planned. Because I think the last meeting a few months ago, I think it was May, was very successful. And since we also have one team member who speaks Dutch now as well, German, English, and Dutch,
okay.
this is a great chance as well.
Yeah, I think that she came to the meeting from Nee Eten with Tanya. So
Tanya is saying yes. Okay, that sounds
The
very
community
good.
building is already happening. Beautiful.
yeah,
That's
Tanya and I know each other. So
good. Yeah, I assumed. For the Netherlands, it's not that big. I feel like people are coming together when they have a common cause. So I think that's beautiful to see. And we hope to build more networks and bring families together and reduce the isolation that a lot of caregivers experience. With that being said, I would say we have 4 more minutes to go. We will close our webinar here. Thank you again for coming. Oh, yeah, Lily?
Yeah, I just want to ask Lisanne if it's a question or I would love to get an update on a possible meeting.
Yeah.
I'm not sure if this is a question or not. Maybe Lisanne, you can say something to it.
Hi, good evening. Thank you for
Hi,
replying to my previous questions. It is, I think it is a kind of question, but I am a member of some Facebook groups, but I'm not sure if it will be shared there or if it will be with Nee Eten or via NoTube or because I haven't heard from Play Picnic before. I'm just discovering NoTube.
Okay.
Oh, okay. Well, welcome. Thank you for finding us. And things will be shared on the Facebook side. So if you
I will also always share in the Kinderen met Zondervoeding group if something is being held in the Netherlands. So we will always promote it and make sure the parents in the Netherlands know if it will be held. So
Great. I'm a member of that Facebook group and also of the NoTube now, so I'll find it then.
perfect. You will be informed. You will
Sorry,
be informed.
Marion. I just wanted to answer this question.
Excellent. Thank you. I didn't see it pop up, so that's beautiful. As you see, we really love to work with each other. So you can see like 2 of our team members here live in action. So thank you for joining us this evening and spending this hour with us, bringing your stories and building community. So please reach out, stay connected, and stay curious of what this new program will bring. So very excited to get it launched. And Julian, too, thank you for joining, for your granddaughter. So thank you again. And to all of you, have a wonderful, wonderful evening. And we hope we'll stay in touch and see each other one way or another. Bye-bye.